Thank you everyone for tuning in, and so happy to have Mayor Mitch Roth with us this morning to do just an initial welcome.
Well, aloha everybody. Thank you for being here. As a follow-up for our mental health summit from I guess it was the summer that we did this, right?
Last August.
Last August. So it's great to see everybody still jumping on and being a part of this. This is such a huge need for the county, and you know we've been working on some things, but really we need to get everybody together, look at what our next steps are and how we can all support each other. So I just wanted to wish you well today. Good luck and looking forward to what comes out of this.
All right, great. Thank you.
All right. Thanks.
Thanks for being with us.
Thanks, everybody. Good to see you.
So this morning, Carlos and Hannah and I are going to be doing this kind of little webinar follow-up to the summit that we held in August that many of you were at. And we've been working hard on the report that with the recommendations coming out of the summit. And our goal and our hope is to reimagine our crisis response here on Hawaii Island, taking a look at what we have and what we don't have and what we need and how we are all going to be moving forward together. So we should introduce each other a little bit more. So I'm Tim Hansen, Executive Assistant to Mayor Mitch Roth here at Hawaii County.
My name is Hannah Unger. I am the intern to Tim this year, working on my master's in social work program through UH Manoa.
And I'm Carlos Chavez-Buretti, helping Tim out as the mental health services advocate here with the County of Hawaii, and also MSW student.
Excellent. So Hannah, why don't you give us our overview?
Yep, and let's go ahead and get our slides up.
Oh, all right, Hannah.
Okay, so I'm going to go ahead and start us off just by covering the agenda for today. So we are going to be taking a look at the national guidelines for behavioral health crisis care, and we're going to be basically comparing that to our current services offered on Hawaii Island and the opportunities for growth. We're also going to follow that up by funding opportunities. Then we're going to summarize those opportunities for growth. And lastly, we're going to talk about ways in which we can all move this forward.
Great. Barrett, I do see that the video on this screen says it's off, but
yeah,
can they see us? So we're operating there. Great. All right, go ahead.
Next slide.
You have to click through. So this one is here, the National Guidelines for Behavioral Health Crisis by SAMHSA. So here we have the example of the guided process. Now, keep in mind, not everyone might need every single step here, but we just wanted to give you a brief overview. So the first one, of course, is someone to talk to, which basically is described like a regional crisis call hub center, operating 24/7 and meeting national standards there. Go ahead. The next one is someone to respond. So this is more the mobile crisis team services and some of the highlights there, offering a response within the community to assist those who need an additional level of care face-to-face. Next, we have a place to go. And this would be someone who needs to actually need a place to be at or come in from the mobile crisis team. Again, just a brief overview. We are going to see these more throughout the presentation. And lastly, of course, we do have the continuum of care. So setting that up for our patients. And then that, concludes this visual of, the post-crisis. So for the national standards, someone to call, again, just to recap here, it should be operating 24/7, 365, staffed, with clinicians, clinical triage, answering every call and coordinating any overflow, assessing a risk of suicide, and coordinating with the crisis mobile team services to respond in a timely fashion. Connecting individuals to, again, those facilities, a place to go if they need to, and then coordinating the transportation as needed for those individuals.
Okay. So let's take a look at what's currently happening on our island as we understand it.
Okay, so first we are going to be going over again the services currently offered with relation to someone to call on Hawaii Island. First off, we have Hawaii Cares, which, as we know, has established the 988 line, which is a behavioral health crisis and suicide call line, right? So that operates, 24 hours a day, 7 days a week. It is statewide and it operates to service both adults and children. We also have crisis counselors, which are focused on supportive counseling, urgent or emergency mental health or substance use needs. They also handle recommendations and referrals for behavioral health assessments, other behavioral health services, and crisis intervention. Again, it's about connecting our clients to resources, and if needed, we do warm handoffs as well to substance use treatment services within that crisis counselor realm.
So we're doing pretty good within this arena, but there are some opportunities for growth. And so as we've traveled around the island doing this presentation, we realize that there isn't very good awareness about 988 and really feel like we need to be engaged in a broader campaign to build awareness about 988. We also need to assure that every call is answered and that there's a coordinated process for the overflow of calls that can't be answered here in Hawaii, and with the ultimate goal of 90% of calls being answered. We'd like to see an expansion of the call center so that it includes the neighbor islands. So right now the call center is centered on Oahu, but we think it could be beneficial to have operators on the other islands as well. And then to reduce burnout and turnover of staff, we think it's important that everybody is trained and that there's sufficient staffing and support, and that's to kind of help reduce that burnout. All right, and so as we move from having someone to call, it's the important aspect of actually having someone to respond as well.
Yeah, so for someone to respond, the national standards advise that, having licensed and or credentialed clinicians, people responding to where the person is, because that could vary between home, work, park, side of the road, connecting with individuals to facility-based care if needed. So again, not every single person is going to need every single step, but it's important to have that available and then also coordinate the transportation through the mobile crisis team.
Great.
Okay, so again, comparing the national guidelines to what we have currently on Hawaii Island with relation to someone to respond. As far as services currently offered, again, we have Care Hawaii, which does crisis mobile outreach, also known as CMOs. They're there to do face-to-face crisis interventions. They are supposed to arrive within 45 minutes of that call. They do a complete risk assessment, and they will also, if needed, refer those individuals to shelters or to stabilization beds. We have crisis mobile outreach both in Hilo and Kona right now. The next thing that we currently have is, as we all know, Hawaii 911 responders. So we have police, fire, and EMS. And we also are working on doing our 4th police crisis intervention team training for our Hawaii Island police officers, which essentially teaches them de-escalation tactics and how to recognize mental health crisis. And lastly, we have Hope Services, which has recently started to outroll their street medicine outreach program, which kind of does more long-acting injectables for people on the streets.
So our island is a big island and there's opportunity for growth definitely around our crisis mobile outreach teams, which are currently coordinated through Care Hawaii. We believe there needs to be an expansion of those teams so that the goal of a 45-minute response is better met. What we've heard is the reality is sometimes that it may take hours for the team to be able to respond. We're excited about the CIT training with the police department and their openness to continue to host trainings. Our goal is to train 40 to 50% of the force, and then eventually to have a freestanding CIT response unit that's part of the police department. We're also, hearing from you all. I think that it's important to consider other response team options, models that are being used across the country. There's ACT teams, ART teams, COPE, Cahoots, lots of different options of teams. And some of those might be a good future fit for us here on Hawaii Island. And then highlighting the importance of data collection. So we know about the progress that we're making. We'd like to have a better sense of the 911 calls that are coming in that are behavioral health related, so that we know as we develop the crisis response system, how it is that we're relieving those calls coming into our 911 dispatch.
So the national standards here for the place to go, it would be basically accepting all referrals. So no requirement of medical clearances, doesn't have to have insurance. Basically, everyone comes in. The services should be addressing mental health, and also they suggest substance use crisis, which most of the time go hand in hand in some cases. Employees, have the access to physical health needs and deliver care. So also physical care is mentioned there. Sometimes people may have wounds, things like that, living on the streets, all part of it. Then we also have the walk-in from first responders and drop-off, and should be at a 90% acceptance rate is what the recommended standard is. We also have a few more here on the next page for a place to go. So be staffed. It should be running again 24/7, 365. Should have psychiatrists, psychologists, multidisciplinary team to handle the variety of physical, mental, and substance related people that may be using the facility. And of course, be screening for suicide and also violence risk.
Okay, so again, comparing that to what we currently have on island. So as far as a place to go, what we currently have, as we know, is the jail or HCCC. Next, we have the hospital emergency rooms. Third, we have the behavioral health units, otherwise known as the psych units. So we have the one in Hilo, Hale, Ho'ola, and then Kalani'ola in Kona. The Hilo one has 6 beds. The Kona one has 10 beds. Also, Care Hawaii offers the LCRSs, which is the Licensed Crisis Residential Services. Those are short-term acute interventions for those experiencing a mental health crisis. They also have that crisis group home in Kona, also 8 beds. And then Mental Health Kokua does group homes, which is more long-term housing for those who are dealing with a mental health illness.
So this is definitely an area where there's opportunities for growth here on the island. Not everybody needs to end up in the emergency rooms and the psych units, and certainly not in the jail. And so our opportunity for growth here on the island is to try to establish a crisis center or crisis hub. They're often referred to as CCBHCs or BHCCs, often kind of models that mix and have a good working relationship. But basically, it's a service hub or a one-stop shop, a center for folks to come to seeking mental health services. And it may be where they get connected with long-term case management. It may be where they get connected with a variety of other options that are here and available to them in the county. And finally, as part of the full equation of having someplace to go, we are in desperate need of a residential crisis stabilization facility. So a place where someone can go for up to 30 days while they themselves and their family and the service providers kind of get that whole support plan, that safety plan together for them to be able to transition successfully back out into the community. So, we heard from you all at the summit, the need in a variety of different ways, but these are kind of the top 3 priorities that we feel we need to move towards. It's not everything, but it would be an important start. Okay.
And then also for the continuum of care, the elements that are suggested by the SAMHSA's minimum requirements here would be a short-term residential facility, which was previously mentioned there as well. The peer-operated respite, so having peer-to-peer support has a great impact, has been seen across the U.S. As a model that does work. And then agency to agency collaboration, basically working together towards the same goal So we don't have multiple people trying to do the same thing, creating memorandums of understanding and supporting each other to meet those goals. And of course, always doing it with a warm handoff.
Okay, so as far as what we currently have, as far as somebody to support us, NAMI, otherwise known as the National Alliance on Mental Illness, is a huge supporter of mental health on island, statewide, nationwide. They provide support groups for family members and individuals dealing with mental health crises or illness. Care Hawaiʻi also does crisis support management. So that's more short-term, 30-day temporary case management. They also do safety planning and linking to community supports. And that is available to those without an ongoing kind of case manager. Next, we have mental health kokua. And that does offer long-term case management as well. And then lastly, with the DOH or the Adult Mental Health Division, they also offer ongoing case management, also do the jail diversion program, which is essentially screening people that are eligible in the criminal justice system to kind of get more treatment as opposed to being incarcerated. And then lastly, we have the clubhouses, both in Hilo and Kona. Actually, currently not in Kona, but we'll get to that. But the clubhouse is essentially a voluntary program that provides a safe environment for their members and emphasizes their strengths and kind of provides them those resources and support.
Great. So just to clarify, we recognize that Care Hawaiʻi is also offering ongoing case management over the long term. Absolutely. So opportunities for growth here on our island. Ms. Hannah mentioned the Kona Paradise Club currently needs to be relocated and is struggling with reopening after the pandemic. We have recognized that there's a need to establish a clubhouse in the Pahoa area. Lots of folks in the Puna district that could benefit from such a center, and driving into Hilo, transportation is a barrier. So it would be great to establish a clubhouse in that area. We'd love to see the expansion of the peer specialist program. These are people with lived experience that can share their own growth and healing journey and give back to the community. Recently touring facilities in Arizona, I would say 50% of their staff across the crisis continuum are peer specialists. And so it's really a huge area that we'd like to see expand. Also, the expansion of telehealth access. So we know that that's a challenge across the island. We heard that really loud and clear at the summit. It's an initiative that continues to be worked on here on the island so that folks can access the care they need via telehealth. There's also the need to increase mental health providers. And so how do we retain those that are working in this field? How do we build the capacity and the numbers of people that are mental health providers? So part of that retention is, the governor has the loan repayment program, which is huge, and we'd love to see that expanded. We realize that housing here is a barrier to many, so we really appreciate Mental Health Kokua's workforce housing project over in Kona that they're working on, and I think that we need to see more of that so people have a place to live when they want to do this important work here on our islands. And then finally, we need to look at reforming some of our licensing processes with the state so that people's licensure can more easily transfer over, and so that those that are working towards full licensure can have preliminary license to kind of keep them involved and connected. And finally, a growth area is just to continue to do presentations and to build awareness and engagement with our community, and to help folks to reduce that sense of stigma around mental health that sometimes is a barrier to people seeking the help that they need.
So funding opportunities, of course, we have your federal, state, philanthropic donations. Some of the opportunities there is to simplify the MedQuest billing process to be able to cover a larger variety of refunding the providers. Funding coalition, so creating task force and work groups to seek funding sources to support all of the work that's being done. Comprehensive service mapping, so kind of an intersect mapping is sometimes it's referred to. So basically seeing what everyone is offering, where we can collaborate, going back to that continuum of care. And then identifying, those grant opportunities as well.
So we just want to do a quick review of the summary of the opportunities that we've noted. And of course, this funding piece is huge because we need that support to make this whole system kind of work. So in regards to having someone to call, the 988 awareness campaign so that people are aware of the existence of that number and we can increase the use, making sure that every call is answered. And again, to coordinate any sort of overflow if the lines are occupied. There's also a little bit of a hitch with 988 right now that calls are directed according to the area code on your phone. So there's a fix that's sort of being put into place that's more about geolocation of where someone is calling so that those calls can be better connected with local services. We'd like to see expansion of the call center to include the neighbor islands and folks that are familiar with the island to be able to respond to those calls. And then, of course, to reduce burnout and making sure that folks are trained and that they have support that they need, as well as that it's sufficiently staffed.
Okay, and then to sum up kind of our summary of opportunities for someone to respond with regard to the crisis mobile outreach or CMOs, we would like to decrease that response time so that it is actually that 45 minutes since the call. We'd like to continue to train our police officers to be CIT trained, so crisis intervention team training. Again, the goal is to get 40 to 50% of the police force trained. And we also eventually would like to we'd like an established HPD CIT response unit. As far as exploring other response teams, like Tim mentioned, models such as the ACT, ART, COPE, and CAHOOTS are other things to look into to hopefully get involved in the community. And then again, data collection, making sure that we are recording how many of those 911 calls are actually behavioral mental health related.
In the area of having a place to go, again, the important need of trying to establish a community behavioral health center or a certified center, mental health service center where people go, get connected with the services that they need, sometimes referred to as a 2359. We would love to see one of these centers both in Hilo and also in Kona, even in other parts of the island, so that there is a place where individuals can go, their families can drop off or bring people to, and it's also available for our police and EMS. And then the longer term need in regards to stabilization facilities. So a spot where folks can go for up to 30 days. And our projections are a need for at least a 16-bed facility.
Okay, and then someone to support us. Again, we do need to relocate the Kona Paradise Clubhouse or also establish a clubhouse in Pahoa. We want to expand our peer specialist programs, expand telehealth access, increase mental health providers. Again, ways in which we can do that is the loan repayment program, workforce housing, and reforming the licensing process. And lastly, again, working on the community engagement and awareness campaign.
Mm-hmm.
So we just want to, share some of the outcomes here from the Adult Mental Health Summit, honor people's, time there and all of the great input that we received. So of course, some of these were included in the presentation, but basically, creating that 24/7 warm line, having people and, be proficient in multiple languages will definitely be a plus. Establishing protocols for situations where, sometimes you call, the call drops off or cell phone service is not available. Some more funding opportunities to, help out with the full range of crisis services that we have and opportunities that we need to develop. Simplifying that MedQuest process has been huge for, Medicaid services in other parts of the country to really help support the work. And then basically just encouraging individual comprehensive mental health safety plans. And then they need to be prioritizing, the basics, food, housing, and financial assistance as well. And then care and support for families and other support systems. And then lastly, we do need to, explore those other initiatives that are out there, even if we start them at a small scale. We just got to start somewhere.
So what role can you all play and can our broader community play as well? We want to provide avenues for people to be engaged and connected. And so on the Hawaii County Mayor's website is going to be kind of a repository of links and resources. It's where a recording of this presentation will be, and kind of that central spot where we hope to continue to provide information about this important area of service. Certainly one of the groups to get connected to is the Hawaii County Service Area Board on Mental Health and Substance Abuse. That group meets on a regular basis. They have told us that they welcome anyone to be able to tune in to those meetings. You'll see on the presentation the web link that you can simply click on to find out when those meetings are happening. And are they monthly or every other month? Okay, so they're happening monthly. It's coordinated out of the Department of Health. And so that would be a great spot for folks to get connected. Another amazing group, which has been so instrumental both in the summit, the follow-up, the CIT trainings, and other responses here in our community, is NAMI. And so we wanted to provide the link there for NAMI Big Island and to support that organization, to help expand the realities of peer specialists as part of NAMI. They do support groups. They have a walk. They just have an amazing group that is important for us to all support. Also connecting with Hilo and Hawaii Community College. You might consider taking courses or directing people there to further their career in the mental health field. It's exciting. Hilo has expanded their counseling or psychology and counseling master's degree program. This fall, it'll be expanding from just 20 students to 30 students. So again, we're building that workforce for the future and for these areas. If we're going to be expanding services, we need folks that are trained and licensed to be able to continue this work. In that spirit, again, the expansion of the peer specialist certification program there on the screen is the link to Department of Health. They're the ones that coordinate that training. Currently, it's on Oahu. I believe that we could provide enough interest here on our island to actually have the team come here and to provide the peer specialist training. I believe it's a 5-day training. I hear it's absolutely amazing. And again, would love to see that happen here on the island. But for now, just connecting people with that certification program on Oahu. And finally, letting your voice be heard, just continuing to share the outcomes of the summit and to be part of the voice of moving things forward, certainly to your elected officials, both on a local and state and federal level. Around funding and initiatives that need to happen, writing letters to the editor or responding to letters that sometimes people submit that just are a bit out of touch with the realities of people's lives and the challenges that they're facing. So always in blogs, I'm old school, so I still get the newspaper and read it actually, but there are other social media outlets and that sort of thing. But to be that voice of reason, to be that voice of compassion in regards to how we're responding to our community members that are struggling with mental health issues. And really talking to anyone who's willing to listen. We are doing this PowerPoint presentation all across the island. And that comes up in our next step, isn't it? So I'll just leave it at that. But let me say that if you have other resources and things that you'd like for us to post on our mental health, the mayor's mental health web page, we're happy to include that as well. So with our voice being heard with our elected officials, Hannah.
So building off of that, I just wanted to highlight some bills to support that have definitely gained some momentum. I saw, Isaac, that you had mentioned in the chat, I believe House Bill 1830, which is establishing an associate licensure for mental health professionals. Essentially, that is moving forward to increase mental health providers, making it a little bit easier for those that are not fully licensed to get in there and be reimbursed, which is huge. Another one worth highlighting is the House Bill 1831, which is establishing a behavioral health crisis center pilot program. It is requiring the DOH to establish 2 BHCCs, one on Oahu and one on another neighborhood island. So hopefully that would be Hawaii Island. And again, you can take a look at this list, but a lot of these kind of are related to moving forward and really prioritizing mental health here.
As we look at next steps in regards to continuing to move this initiative forward, some of the things that we want to share with you is we are establishing the 5 work groups that really came out of the summit. Some folks have already been meeting around some of these, but the 5 work groups is someone to call, someone to respond, a place to go, someone to support us, and then the funding that's needed to move these initiatives forward. So we invite you, if you're interested in working specifically in any of these groups, to go ahead and email Carlos and let him know what work group you'd like to maybe connect with, either as part of your work or your passion or both. And we will be setting up Zoom virtual meetings in the next 3 months
over the next year.
Over the next 3 months, each of these groups will have met and continue to work on some of these initiatives. We've already rolled out these presentations. We've started to do them at some of the Rotary clubs or other groups. We'd love to hear your suggestions in regards to other groups or places that we could maybe go. Carlos is amazing. He's taken this kind of 45-minute presentation and we've weeded it down. So we have a 30-minute presentation, and we even have a 15-minute presentation that really just hones in on some of the recommendations that we have for our island. It's been very well received at the places that we've done it. We try to be as mindful of the time as possible, which is often a challenge, but please know that we are available to come and do these presentations at any sort of gathering. Maybe it's a staff meeting or at a community group or wherever. We just want to continue to get the word out about this. A very exciting initiative that seems to be developing is you can see the picture of the old Bank of Hawaii building, which is on the corner of Kavili and Highway 11. We are trying to get this building from the state in order for us to establish a resource hub, a mental health service center. Not quite sure if it's a BHCC or the CCBHC or whatever alphabet soup that we want to call it, but basically it's a place for our services to be centralized, for people to get connected, a place to go, to be in a peaceful, caring environment, to get stable over a short term. It wouldn't be an overnight sort of thing, but it would hopefully be a center that's open 24 hours a day. So we're working on this and just kind of wanted to put that out there as a vision, as a goal, as a hope for our community. It's going to take a partnership between the county, the state, Department of Health, and other service providers in order to make this dream a reality. But I think it'll be a huge step forward for us if we're able to make it, to help it. Funding, of course, is going to be needed. So I'm excited to announce that the Hilo Medical Center Foundation is establishing a mental health fund. And so they're a nonprofit foundation that can accept donations. There's already a potential contribution of a $500,000 donation to help support and move mental health crisis services forward here on our island. Soon, we hope to have a QR code and set up a way that people will be able to quickly and easily make donations to that fund, because we realize it needs to be a private-public partnership in regards to helping to move these things forward. Another exciting development that's happened here on our island is Big Island Substance Abuse Council has established a detox clinic center here in Hilo. They opened a couple weeks ago. So already we're at the point of helping folks to be able to address their drug treatment issues. Right now, that facility is serving 8 individuals, and we hope to see that expand with additional funding and support. And as I think Hannah mentioned, we're doing the crisis intervention training with the police department. We're doing our 4th training in March over on the Kona side. And then we should be getting close to 80 officers that are trained. So we really appreciate the excitement and partnership with NAMI and also with the police department in order to move that important work forward. What we've heard from the officers in all 3 of the trainings that we've done is it's great that we train them, but where do they take people? What are the options besides taking them to jail or taking them to the emergency room at the hospitals? And so again, setting up a spot, a hub, a behavioral health crisis center, a spot where officers might bring somebody who's experienced a mental health crisis so that they can stabilize and get connected with services. That's the importance of the outcome of that work. And then we're also open to the idea of potentially holding another summit later this year in the summer or in the fall as we continue to build the momentum, keep it going, keep people engaged. Again, so glad that you all dedicated this time to come back and be with us as we're trying to expand, the work that we're doing and partnership that we want to continue to build. Again, be in touch with us. Email Carlos about those work groups if you want to be connected. And surprisingly, we actually have a little bit of time to be able to take some questions, and unless there's some things that Hannah or Carlos that you feel like we've missed or that you want to add?
I do not.
Okay, so I did see that there was a chat, a couple of things that were
You open the
noted.
chat, yeah.
So I think somebody asked if this PowerPoint is available, and it certainly is. It will be on the mayor's website in regards to being able to access some of this information.
So it's not there yet. We're still putting everything together, but we should hopefully have it here up in the next 2 to 3 weeks. So keep an eye out for that.
Brandy, thanks for your question in regards to presenting to CAP. We absolutely would love to present to CAP. We're presenting to the Community Action Network to CAN next week. Yep, next week, Wednesday. And so we'd love to be able to have an invitation and to come and speak to CAP. Absolutely. In regards to what sort of space or amenities might need to be available to open a Pahoa clubhouse, would love to engage in that conversation. We'd have to include Department of Health in that they are the ones at this point that are funding the clubhouses and staff the clubhouses. It doesn't mean that that's the only model, because in a lot of communities, it's actually community nonprofits that establish a clubhouse. And so I think that there's some creative opportunities and options in regards to what that might look like. In fact, NAMI as an organization actually operates some of the clubhouses across the country. So would love to continue to engage in that. What else did Brandy say with that?
I think that's it.
Okay.
Yeah.
Great. So Isaac, I think there was a second part to what Brandy had to say. There we go. Incorporate into our next housing development project, same property as our micro shelters. Great. Yeah. So I think continuing to have that conversation and what that might look like. Clubhouses, you could do a search on them. It's a nationwide, it might even be an international effort, where the members are folks with lived experiences that are needing a clubhouse, a space to come together to support one another. Most of them are set up as a nonprofit. So they provide meals and also do fundraisers and that sort of thing to stay engaged and to fulfill a purpose in the community and to kind of help build the initiative. It's often a job training and job support, job coaching kind of setting. So yeah, would love to engage more about that, can connect you with the folks here in Hilo that operate the clubhouse and the amazing work that they're doing. Chad, don't forget Ohana CCS is one of the biggest resources in the mental health continuum of care for qualified people. Absolutely. And Chad, is there a particular bill that you're aware of that's currently going through the legislature that we should maybe be aware of in regards to the work of the CCSs?
I don't think there's anything in the legislature. There are possible changes in Medicaid through the 1115 waiver discussions and process.
Great. Thank you. But yeah, that ongoing support, that long-term case management, that way of supporting the families as well as the individuals is so important. And Chad just highlights there the importance of needing to adjust our MedQuest, our Medicaid reimbursement policies, practices, so that more of these services can be supported and exist in our community, giving access to folks that need it. Any other questions, comments, or things that folks want to put in the chat? Okay. You know, the little icons where you can share reactions and that kind of thing across the screen. What are people's interest in regards to holding another mental health summit gathering? It may, I don't know if it would be August or September, but sometime this year. Is that something that you feel would be worthwhile and another opportunity to come together? I see some couple of thumbs up. I'm seeing some nodding of heads. Okay. Great. Great. Yes. So that is something that we can continue to work on. I think having a space where folks can come together and continue to explore options. I know that Hope Services is working on an ACT team, which is an important part of our crisis response continuum as well. And so maybe the summit could be something where we could highlight that as some awareness building as well. Wondering if Kathy, or I'm not sure if Susan is with us, but any folks from NAMI like to just kind of open up a little bit of time for you. Oh, good. I see Susan as well. Any comments or feedback or anything that you'd like to add to this gathering?
Great job. Great job, all of you.
Great job.
Very
Wonderful job.
inspiring. And we're happy to support in whatever way that we can.
Thank you.
Great. Kathy, yes, please.
Hi, yes, thank you so much for putting this together and summarizing it so well in such a short period of time. I think it's very helpful. Also, I just wanted to let you know that the chat's not working because I have been putting something in the chat. So I'll just let you know that Going Home Hawaii is also involved in the MedQuest 1115 and also in doing sequential intercept model mapping on the Big Island. So, you know, I think it would be great if we could get them to come to this also. I think they'd be a very good partner for us.
Excellent.
And
Thank you.
everybody for coming, and thank you so much for all your work with the summit. And I think having another summit and using this momentum is going to be very helpful. So I certainly support that.
Okay. Thanks, Kathy. And I'm sorry that the chat feature isn't working. You can always follow up with emails
Yeah.
to us as well.
Yeah.
Yeah, we talked
Okay.
about that a little bit. And yes, Shelley is suggesting that as the work groups continue to meet and we kind of hone down some plans to move some of these projects forward, could help us to focus on the summit to give us more direction. It's such a, well, you all know there's so many moving pieces to this continuum of care. And again, you know, many folks are highlighting the system that Arizona has in place or Florida has in place. That's largely funded through Medicaid dollars and that sort of thing. And it's a lot to take on. Again, everything from the building the awareness and having someone to call and that response, place to go, all that whole continuum of care. But when a community comes together and is committed to making it happen, it's pretty amazing to see those pieces. And you know, we need the crisis response teams, but again, we also just need a place for people to go, and then we need a place for people to be over the long term in order to stabilize, and then that ongoing support to keep people out of the crisis kind of spiral, and then that huge support for the families and those that love these individuals, that want the best for them and need the support and the resources in order to you know, keep themselves stable along with their loved one. That's the passion, that's the hope, that's the momentum as we try to move this forward. A huge amount of information that we gathered at the summit. It's been quite a challenge to summarize it into some specific talking points. And I really want to give kudos to Carlos, who's worked hard in helping to make that happen. And yeah, we want to continue this forward. Kathy, I see your hand is up again. I don't know if it's still up or if it's up again, but I'm going to give you the floor.
Sorry, it's up again. You know, getting old and forgetful. I just would like to ask if you could put in there too. One of the things that we do that I think is very informative for the community is we do education programs, psychoeducation programs, skills building programs, both for peers, so people living with mental health conditions, and also for the family members that are supporting them. And we have a presentation that we do specifically for the community. We've been getting some interest in that from people in the community that want to help, and they want to know more about mental health so that they can help. And so that's available as well. And all those programs, the support programs and the education programs, are all offered free of charge.
Great. And the best way to connect is through that website that we put up for Big Island, NAMI?
Yes, or through Susan or me, either way.
Great.
Yeah.
Great. Yeah, so appreciative of the amazing work that NAMI does in our community, and look forward to the upcoming walk that should be getting planned so that we can also provide the support that you guys need to be moving things forward.
Thank you for your support, Tim.
Yeah. So yeah, we are so blessed to be on this island and to have the care and compassion that we have, to be able to move these initiatives forward, to have a leader such as Mitch Roth that creates the space and positions and resources to be able to help a gathering that like we've had, and that it's not just a one and done sort of type thing, but we're continuing to move this initiative forward, and again, working with the governor and with his team at the Department of Health, just so appreciative, along with all of the various community partners. And I just know that we are going to continue to make this a better and safe and healthy place for all of our community members, even with our diverse perspectives on the world and our different levels of reality as we struggle with mental health issues. But just excited to be part of this ongoing movement forward with all of you. And again, just want to thank you so much for joining us. And we will continue to be in touch, as we hope that you will with us and with the work groups. And again, please let us know if there's other spaces and times that we could come and help hold this sort of presentation and discussion, especially around 988 and all of these various services. So with that, it's time for the final wrap up.
Thank you.
Yeah, thank you guys.
All right. Thank you all for joining us.